lip lift surgery is a very minor surgical procedure that can have a dramatic impact on your facial aesthetics and cosmetic look. And for such a small, minor procedure with such a big impact, it is a very delicate surgery, but could be a very tricky surgery and a procedure that you really want to do your research, investigating, looking for the right surgeon, and also prepping for the surgery, and also following through with the appropriate aftercare to ensure the best results. Because although it's a very small procedure, it packs a big punch on your overall aesthetics, and you want to do it the right way and ensure the best outcomes and the least amount of complications. And in this video, I will share that information with you as a sequela to my 2 other videos that I posted to take you through my upper lip lift journey. So this was my second time around. About 4 or 5 years ago, I had my first upper lip lift surgery. And the reason why I wanted to have this surgery done in the past, when I was about 41 years old, I wanted to have it done because I felt like when I smiled, my smile was changing over time, and that may have been for a few different reasons, but my main reason for having lip lift surgery was because I wanted to show my teeth more when I smiled. I felt like you can't see my teeth anymore. And also the distance between my upper lip and my nose had lengthened with time. I mean, I'm almost 50 years old, so that is to be expected. That's one of the changes and signs of aging, is lengthening of your philtrum, the distance between your upper lip and your nose, and then also flattening of the upper lip. I used to have a very prominent philtrum and very prominent Cupid's bow, which is like this, let me grab a little contact applicator, which is this area of their upper lip that kind of gives that, like, you know, just kind of that definition. I felt like that had flattened over time, whereas in my early 20s, I had 2 little pointy peaks of my Cupid's bow and a very prominent philtrum. So I felt like I wanted to get back to my old self, how I used to look, and then also just show my teeth when I smile, which was my main indication of having the surgery. Now, I've had upper lip lift surgery twice. First time around, I loved my results, but the results didn't last. And I tried to correct some of the issues that I had with my first surgery because I loved the results, but because they didn't last, I wanted to do the surgery a second time around when I was ready, which was just less than 3 months ago, and go through it the right way, have the ideal prep, have the ideal aftercare to ensure the best cosmetic results and outcome, and also find a surgeon that had a different surgical technique and style to ensure that I got the results that I wanted and had the aesthetic look that I wanted, and then results that actually lasted. Because like I said, my first lip lift surgery, I loved the results, but they literally only lasted for like 3 to 6 months, and then I was back to where I was before, which was very disappointing because I had like a taste of what it would look like. That's why I knew I wanted to do it again. And when I did it again, my second surgery, second time around, I feel like we did it right. And when I say we, I mean myself, with the pre-operative treatments that I did, my surgeon, who is Dr. Michael Rossi in San Diego, who's a very good friend of mine and a very talented cosmetic plastic surgeon, and then also the aftercare, which we kind of talked about together. And I'll give you a little kind of rundown of what I did afterwards. But if you wanted to refer to my other first YouTube videos, where I actually take you through my preparation and then also my immediate after transition through the whole lip lift process. And then I believe I did another video like a couple weeks later, so you could see what I was looking like. So if you want to follow my videos, you can go through the whole surgical procedure, my journey with me. And also, this is my 3-month follow-up video, status post lip lift surgery as a patient. So I wanted to give you guys this information. And I think that this video might be comprehensive to you guys if you're thinking about lip lift surgery, if you're thinking about it and balancing out the results with the complication risks or things that could potentially go wrong. Is it right for you? What could you do to prepare? What could you do to ensure the best outcome? This video will be for you. And this is coming not only from me as a patient who has had it done twice, but also as a surgeon myself. Just kind of having perspectives from different, as a patient and a physician, may be very impactful. So I hope you find this useful, because when I was looking for information on lip lift surgery, it was really, really hard to find videos out there that were very meaningful, impactful, and informative and comprehensive. So when I was also looking into different consults with different physicians, I would call sometimes the offices and ask, like, does Dr. So-and-so do upper lip lift surgery? And a lot of offices would say he doesn't do that surgery unless it's incorporated with a facelift. So that was kind of like my red flag number 1. Number 2, if you do find a surgery or a surgeon or a plastic surgeon who does upper lip lift surgery, it's nice to have it done, in my personal opinion, under local anesthetic. Dr. Rossi only used, I think, 4 or 5 cc's of lidocaine. I don't know if I have a syringe around here, but 4 cc's of lidocaine is tiny. It's hardly anything at all. You don't need general anesthesia and intubation in an OR and like a surgical suite and a whole big production. A, that's not healthy for your body. B, anytime you can get away from general anesthesia and an intubation, I think as a physician and as a patient and as a mom and as a daughter, I feel like it's best. And Dr. Rossi performed the procedure, which is a simple local injection. I didn't feel anything. I had zero pain. When I woke up from the procedure, when my skin woke up, like when the lidocaine and local anesthetic wore off, I was in a little bit of discomfort, but it honestly wasn't bad at all. I took 2 Tylenol immediately after when I woke up from the surgery, and I also had to take a Benadryl because I get really, really swollen. And if you look at my videos, it's terrifying because I was so swollen. I get more swollen than the average person, so don't let that scare you. But I literally just took 2 Tylenol and then Benadryl for swelling, and then, you know, I also took arnica, bromelain. I took my supplements and creatine. I ate really clean, but I didn't really need anything for pain at all. So I think having the procedure done in an office just like this, where you can walk out and you're not like out of it from anesthesia, it's not a huge stressor on your body, and you just have a little bit of anesthesia, I think that that's best. So looking for a surgeon who does isolated lip lift surgery, does it without general anesthesia and under local anesthesia is best. And then also look for a surgeon who does a ton of these and look at their before and afters. You'd be surprised how many people post other doctors before and afters, which, you know, I don't mean to be like the internet police out there, but there's people who even post my before and afters in their office for like lasers and other dermatologic procedures. But make sure that your surgeon, you feel very comfortable with him or her. Make sure that they do a ton of isolated upper lip lift surgery. Make sure that they pay attention to detail and look at their before and afters and see if those before and afters resonate with you, or you would be happy with the results that you're seeing in their own personal before and afters with their own personal patients. So you guys have to remember, I'm less than 3 months out. I'm 1 week shy of 3 months status post upper lip lift surgery. And I'm very transparent with the procedures that I do. I post them on YouTube, I post them on Instagram. I get a lot of people thanking me for being very transparent with what I do, but I also get, you know, negative people making really mean comments, which, you know, it comes with the territory. But I do want to be very transparent and kind of, you know, educate you guys on what I do as a dermatologist and procedural dermatologist and aesthetic, someone who's been doing aesthetic prejuvenation treatments from the time I was probably 20 years old. Now I'm almost 50 years old, and I really feel like I was ahead of my time with doing preventative treatments earlier on, and just why I do things and explaining these procedures that I decide to have done with you guys. But also, you know, there's a lot of negative, you know, haters out there that are going to say mean things, and a lot of comments that I got that were negative immediately after my lip lift surgery were, you know, comments about how, you know, my teeth show too much, or you know, just like really rude comments. But you have to remember that you don't want to look good 1 or 2 or 3 weeks after, or even maybe 1 or 2 or 3 months after surgery, because it takes months and months for a lip lift surgery results to settle, as with any surgery. So you have to give it time. And so if I would have posted a YouTube video and listened to the people who were saying mean comments like 1 week after, I would have tried to fix things, then I wouldn't like the result that was long term. So all I care about, and as a patient, all you should care about, is what your results look like long term. I don't care if you're talking about a lip lift, a facelift, upper eyelid blepharoplasty. It takes time for the skin to settle, for scars to remodel, for the results to kind of have their final phase that they're in, and that usually doesn't happen for at least 6 to 12 months status post a surgery. So 12 months, almost a year later after surgery, that's usually what the result's gonna look like, and that's what the long-term result's gonna look like for 5, 10, 15, 20 years, depending on the surgery. So I was kind of ignoring those comments because I would rather look good long-term and later on than look good 1 week after my lip lift surgery, or like 1 month afterwards. So if you see any of those comments, I'm disregarding them, and you should too, and you shouldn't be obsessed about what your results look like immediately after, because it's the long-term results that matter, and that's what lasts a lifetime, or however long they're gonna last. And that's when you can kind of start doing lasers or resurfacing or scar rejuvenation and things like that. But honestly, Dr. Rossi in San Diego was so great that if I'll look up close, like you can't even see. I mean, if you look up really close, you can see my scar right here, but it's barely discernible. And I haven't even touched this with a laser, and I have every laser in the world here in my office to treat redness, texture, hyperpigmentation, scar spread, everything. And I haven't had to even touch my scar with a laser, but I think it all has to do with the surgical technique, my pre-op care, and my aftercare. So I'll share that with you. So being just 3 months out after lip lift surgery, things are still settling, and honestly, I change week by week. Each week it gets better and better. And people in the comments in my videos, because I do a YouTube video each week, you can literally like track my progress and see things starting to settle. And part of the pre-operative treatment that I did, and Dr. Rossi and I talked about this, I did Botox. Okay guys, I'm gonna show you how I did Botox on myself. We did 2 units, 1, 1, 1, right at the base of my philtrum. 2, 2, you can see it. And then 1, 1, 1, right? 1. If you do gummy smile Botox, it's usually in the apical triangle on the superior nasolabial fold area, which is right here. So I kind of did a no-fly zone Botox treatment, but just to immobilize those muscles because I didn't want to create scar spread or wound tension. So speaking as a Mohs micrographic surgeon, I'm a now retired skin cancer surgeon. I don't do skin cancer surgery anymore, but sometimes when there was a lot of tension on a wound, like when you know the tissue's kind of like pulling on each other and the muscles are pulling, it can create scar spread. So where the incision is, it widens it. And sometimes when you see people with horrible lip lift scars, they have these like widened scars, which A, has to do with the surgeon, but B, also because there's so much wound tension on that area. So what I did, I actually did it just like, I think like a day or 2 before the surgery, which I wish I would have done it like 2 weeks before the surgery, because that's how long it really takes Botox or a neuromodulator to kick in for the average person. But we did a little Botox around here, 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 and I have actually the number of units in the actual injection sites in my video where I talk about the preparation for lip lift surgery. So if you're thinking about lip lift surgery, talk to your surgeon about this, because I do think doing Botox around this whole area just to immobilize the muscles, immobilize the skin, and allow the wound edges approximated to just heal without all this pulling tension, creating like a really a larger, more significant and more noticeable scar. I think doing Botox in that area really helps protect the scar, and it does feel weird, like when you know, are done with your surgery and the swelling goes away. I literally had a hard time talking and bringing my lips together for a while, and you know, people were making fun of the way I talked and the way I looked, but honestly it was because the Botox was there protecting my scar, because 12 months from now, 1 year later in post, is what I really cared about the scar looking like. So I didn't mind looking weird or feeling weird having Botox in my upper lip or my philtrum, because I knew that the purpose of that Botox was to ensure the best incision line and the best scar possible. And the caveat and downside of it is, okay, so you slur your words and you can't really talk for, you know, a couple months, and you know, it's definitely well worth the results. I was thinking about even doing Daxxify, which is a longer lasting neuromodulator than Botox, but I was like, well, if I like the, you know, the scar and the way it's looking, and in 3 months after the surgery, which is I'm not even at that point yet, because it's been 1 week less than 3 months, then I could do Botox again. But the reason why a lot of people have said, why didn't you just do Daxxify so it lasted longer? I wasn't sure if I didn't want to be that fully committed, because you know, if I have the Botox start to wear off, which is it's starting to wear off right now, I could just redo it again, and I might. So I'm just getting to the point where, like, you know, I can, if I force myself to, I can close my mouth and I can kind of mobilize my upper lip and move my muscles, but I don't want to, because I want to protect this lip lift you know, result. And I feel like the first time around when I had my lip lift, I was moving and I was trying to like pull my lips together, and I feel like it stretched it out, and I feel like that may have been, you know, my fault, and one of the reasons why my lip lift result didn't last the first time around. So as crazy as I may look now, and as much as my upper lip isn't moving, I'm ensuring results long term, and that's what's most important to me. So I'm still, like I said, less than 3 months out, so it hasn't really fully worn off, but the Botox is definitely still kicked in. Now, another change that I noticed is I've dissolved all my fillers. So if I look different, you guys have to keep in mind I dissolved any and all filler that was ever in this vicinity in my face. And 20% will dissolve in real time, but the rest of it will dissolve over the next 2 weeks. Okay guys, hyaluronic. Mind over matter, this stings, I'm not gonna lie. Oh. finished round 2 after dissolving filler using the hyaluronidase. I'm actually not too swollen. I just dissolved it in like my mid Cupid's bow and upper lip, and I'm driving into work right now, and the hyaluronidase, I'm not like that swollen, and it was a little painful, a little immediate stinging when it was injected, but then after that there's like no pain at all. So this is what it looks like after you inject the hyaluronidase. And I just wanted to kind of just start with like a fresh face. I've always been more of a laser and device girl, even like in my 20s and 30s. I was never like a big filler person. I've always believed in inducing your skin's own regenerative processes to upregulate collagen synthesis, because when I would look at skin under the microscope, when I was young, I would notice that old people, which is now my age now, almost 50, I just turned 48 last week, so I'm up there. But I remember when I would look at people my age, their skin under the microscope, back when I was a baby, I'm like, wow, these people stopped making collagen, and those fibroblasts aren't making collagen or elastin. They don't have any extracellular matrix fibers anymore. I think enhancing your body's ability to make those proteins, the collagen, the elastin, I always thought that was a better approach. That's why I started doing like lasers and rejuvenation early on in my life, because I wanted to like collagen bank and use lasers and energy-based devices to upregulate my skin's ability to keep up with the collagen production process, because inherently that just creates more youthful, bouncy, tight, firm skin. And so I never was a big filler person, but I do remember, in residency, I did my residency at UCLA. We were in the middle of like West LA. Even when we would moonlight, we were like in Beverly Hills, Rodeo Drive, Santa Monica, Hollywood. Like it was the epicenter of just fillers and injectables. And this was like, back in the earlier 2000s. And I was exposed to a lot of fillers at a young age. I never did a lot of filler myself, but I had done a little bit of filler in my lips. And I remember when I was in my early 30s, I remember being so paranoid of getting lip lines that I would do lip flip Botox. I would do Botox around my lip lines to prevent, the orbicularis oris muscle from contracting that skin and making those little lines. But I also put a little bit of filler in this area to make sure that I didn't form those lines, those etched in lines, because when I was 48 or 50 years old, like I am now, I didn't want etched in lines. And honestly, to be honest, it worked. Maybe it's also because I was doing Fraxel and other lasers, but being 48 years old and having 0 lip lines, that may have been a product of me doing lasers, or it could have been, the filler that was kind of buttressing that skin and protecting that skin from folding on itself. So I hadn't done filler in that area since like my 30s. And before my lip lift surgery, Dr. Rossi was like, just flood your skin with hyaluronidase. Hyaluronidase is also called Vitrace, and it's a filler dissolving solution. And I'm like, I don't need to dissolve anything because I haven't done filler in forever. And he's like, just in case there's anything there, we do know that filler can last a longer amount of time. So I just I probably did like 3 or 4 rounds of hyaluronidase, and I used several vials of hyaluronidase and just injected. I even have it on videos if you want to look at my old YouTube videos. I'm injecting myself with just a ton of hyaluronidase to dissolve any and all filler that may have been left behind since my 30s when I did, when I was messing around with fillers. So that also had an impact too, and I feel like maybe changed my lower face or like any area around my mouth. So not only have I had lip lift surgery, and not only am I Botoxed in this area, but I've dissolved any and all filler like in my lower face and around my periorbital area. I actually don't have any filler anywhere in my face, and I think I'm going to keep it that way, because now that I get older, filler was fun to mess around with in my 20s, but like now that I'm in my late 40s and entering my 50s, I don't want to be like overfilled, and it's like a personal preference. Filler does play a role in certain things, but I'm trying to or in certain aesthetic goals that you're trying to reach, but I think that, I'm more of a laser and device girl, so I'm going to stick with that. So it actually was really nice for me to just wipe my skin clean of any filler, and I think that I did not do that during my first lip lift procedure, and that's where I went wrong, because you want your surgeon to be working just with the skin and be dealing with like your actual baseline anatomy, not artificial anatomy that may be affected by any dermal filler in your face. So even if you haven't had filler for years, I would say if you're going to have lip lift or even a facelift, it's good to just start from scratch and dissolve filler, any and all filler that may be there, even if it's been a while, because it may still be there. You never really know. So dermal filler is just hyaluronic acid. It's the natural ground substance of our skin, and the downside is, okay, it may stay there longer than we had anticipated, or I may want to have a surgery and not want filler anymore. It's easy to get rid of. It's easy to dissolve, and it's not bad for you. It's not bad for your skin. So don't, be careful with the fear mongering out there, because I hate to call other doctors out, but like plastic surgeons want you in the OR. They don't want you doing Thermage or Sculptra or biostimulatory fillers or fillers at all. They just want to be operating on you. And they're also, I have patients in my office who I see in their like late 20s, early 30s who are getting facelifts because their doctors told them that they shouldn't have filler. And that's also another problem in and of itself. So just take it with a grain of salt, know where your doctor is coming from. And you know, if filler is not the worst thing in the world, I personally, again, I decided to just dissolve any filler that may have been there just because I wanted to go with that more like natural looking approach, and I wanted my surgeon to have like my actual true natural baseline. But if you do fillers, it's easy to get rid of. You just dissolve it and it goes away. So no major problem there. So just to clarify, you guys. And speaking as a dermatologic surgeon, usually after we would do most skin cancer surgery, there'd be what we call a post-operative defect, like huge holes in the faces or like on the nose, where we'd have to rebuild, take cartilage from the ear and put it in the nose to make a new nasal ala, and moving skin around. And most of the patients that I was operating on who had skin cancer were also patients who were doing thermage and Sculptra, because I was usually in a compounded, you know, aesthetic practice where we did Mohs micrographic surgery and aesthetics. So I've operated on hundreds, probably even thousands of patients who had Sculptra and thermage and filler, and it's never been a problem, like aesthetically, when you're doing reconstructive surgery. So the number one most important rule when looking into lip lift surgery is to find the right surgeon. Dr. Michael Rossi in San Diego, who's a very dear friend of mine and a very talented cosmetic and plastic surgeon. He's amazing, and his attention to detail was impeccable. He took out calipers, he drew on my face, he did measurements. I think I was asymmetric, so he took more on one side than the other. A lot of you guys have asked me how many millimeters he took, but honestly, how many millimeters he took on me is irrelevant because it all depends on your individual anatomy. Each patient by patient basis has a different amount of skin that may be needed to take. It has to do with the thickness of your skin, and like when you avert the edges, how much does it pull up. Another procedure that he actually did talk to me about that I didn't do is almost like a Vermillion border lip lift. So when he took the skin, he actually took, it was called the bullhorn technique, and there's several different techniques. He went with the bullhorn technique. Again, refer to that video because I have an intraoperative video of him actually doing the surgery on me, but graphic details, so warning on that one. But he basically took skin from my outside of my nasal ala all the way down to about this edge of my mouth, and that kind of goes with my normal lip anatomy. I've always kind of had a more peaked upper lip and not as much red part of my lip showing on the sides, but doing a little incision here would be the next step if we wanted to do that. But I feel like that's not staying within the natural confines of my lips, and the way my lips are now are more similar to how they were like in my early 20s before I started doing anything. So I feel that I'm happy with the results now, but that's also a part to a lip lift surgery, is sometimes when they take a little incision along the Vermillion border and they have more red show of the lip, the red part of your lip showing. So he did use the bullhorn technique. I'm not sure how many millimeters he took. I can get that information to you guys and put it in the comment section if you're curious, but it shouldn't matter anyway because each patient is different, and when your surgeon is evaluating you as a lip lift candidate, they should make markings with a surgical marking pen, use calipers, and be very precise and meticulous, OCD and type A, which Dr. Rossi is. That's why we're good friends. We kind of share that in common together. He has a very artistic eye, but he's also very calculated. Attention to detail is everything, especially with lip lift surgery. Upper eyelid blepharoplasty is the other surgery where you have to, it's unforgiving. Like you can't be a millimeter off or it will dramatically change the facial aesthetics and the results. So measurements, a type A, very meticulous surgeon is really, really important. And you want to go with a surgeon who does individual lip lifts a la carte, I would say. A lot of plastic surgeons will throw in a lip lift with, a facelift and a neck lift and other procedures. Not a lot of them do an a la carte, like a standing alone procedure, but I think that's the way that aesthetics is going in today's world. It used to be that people wouldn't have surgery until they were in their 6th or 7th decade of life, and then they get the whole menu. They get the upper eyelid blepharoplasty, the lower eyelid blepharoplasty, the brow lift, the facelift, the neck lift, the fat transfer, and like everything in one, even though they may not need everything, but they kind of just did everything at once. Where now is, I think people are just doing like a little minor lower lip facelift procedure, and then a little upper eyelid blepharoplasty, and then maybe a lip lift, and then maybe 10 years later, then they do a whole facelift. So you want to get a surgeon who's just going to do upper lip lift surgery. And even looking into plastic surgeons myself, I again went with Dr. Michael Rossi because he's very talented, and I've seen his before and afters, and I know he does this surgery a lot, just a standalone, which is really, really important because some offices won't do your lip lift unless you get a whole $150,000 facelift and neck lift surgery, which A, is I don't think ethical, and B, you want to go to a surgeon who's just going to do a lip lift if that's all you need. Now, of course, if you need the other procedures too, go ahead and do it all together, but don't be pressured into having a facelift just because you want a lip lift. Don't be pressured into having a facelift because that's the only way that you're going to get your lip lift is by adding it in with another surgery, because that is not, I don't think that that's ethical, and I don't think that that's good for any individual patient. Now, the cost of a lip lift surgery can be anywhere from $2,000 to $3,000, maybe $1,000 to $10,000 or even more. Gosh, I think there was even one doctor who wasn't, I'm in Orange County, California, he was in New York, and he was like $120,000 for an upper lip lift, which is ridiculous. I think that, of course, you get what you pay for, and you want to have a surgeon who takes pride in his or her work, and sometimes the better surgeons will have a higher price tag, but it doesn't have to be that astronomical. I think for a good lip lift surgery, personally, it could be anywhere from maybe $5,000, $6,000, $7,000 to maybe $10,000, $11,000, $12,000. I would say in that ballpark, and I'm just talking to you as a friend. I actually don't really know the price of a lip lift, and just shopping around different plastic surgeons for myself as a patient, it was all over the place. But you also don't want someone too inexpensive, because they may be not that expensive for a reason. People who take a lot of pride in their work and have a lot of years of training and are very good at what they do, sometimes the price is higher. So I think the sweet price point, or like the average price for an upper lip lift surgery, could be anywhere from like $5,000 to $10,000, I think. And if you're watching this video, it's 2025 right now. If this is 3 or 4 years later, those prices may change, but I think that that's usually the ballpark. Again, it may change depending on the surgeon and where you're located, but I think that that's kind of a appreciable or acceptable price range for upper lip lift surgery. So we talked about finding the right surgeon, how the surgical technique is very important, how I prepped for my lip lift surgery, my aftercare, and still tracking my progress. And I think the most important thing too is just remember, anything in aesthetics that's worth it or a truly good result usually takes time. Now, whether you're talking about an energy-based device that's going to induce collagen baking, those fibroblast cells that make collagen in your skin don't turn on their upregulation of collagen synthesis right away. It may take 2 or 3 months to even start to notice a hint of a result, and take about 1 year to fully manifest those results. When you're looking at surgery, you can't obsess, and I'm talking about not only upper lip lift surgery, but like blepharoplasty too, eyelid surgery. You can't obsess about your results 1 month later or 2 months later. It's the long-term results. Again, it takes about 6 to 12 months for surgical results to finally settle, and then you can kind of start futzing with things. You can laser, you can, have I guess sometimes plastic surgeons will have to repeat or kind of revise scars, and I think that the problem in aesthetics is that sometimes patients, including myself, can be impatient, which is ironic. So I think patients a lot of time will shoot themselves in the foot because, say, immediately after lip lift surgery, I'm like, oh my gosh, I can't move my mouth, I don't like my scar, my lips won't come together, and I stretch my scar out, and I try to counteract the effects of the Botox, and I just shoot myself in the foot and end up having a less than ideal long-term result because I was too focused on what I look like 2 weeks after or 2 months after. So just patience, tincture of time, have trust in your surgeon, trust the process, and just don't be too crazy and irrational and impatient immediately after a lip lift surgery or an upper eyelid blepharoplasty or a thermage or lip filler, because you got to let the dust settle. It takes time for results to truly manifest and for you to really assess your results and if you're happy with the results. But with the right surgeon, the right surgical technique, the right pre and post aftercare, and realistic and manageable expectations, a lip lift surgery for the right candidate with the right provider can be chef's kiss. Now, I'm going to see if Dr. Michael Rossi will come on my YouTube channel and kind of talk about the procedure, because he has such a great aesthetic eye, and also because he had a different surgical technique too. So he did anchoring stitches, and he did a lot of extra attention to detail, suturing techniques and surgical techniques that maybe others don't, and that's what sets him apart from other surgeons as a lip lift. Like, I would go to him, and I would recommend everyone in the world to go to him, because I really truly feel that he's super talented, and it was the attention to detail. And I remember after my lip lift surgery, so this is just a side note and personal, probably like TMI, but something about myself is I can't take any steroids or prednisone because my intraocular pressure goes up in my eye. I'm what we call a steroid responder. I learned that about myself in my first year of medical school. If I take any steroids, like if I have a bee sting or if I have something and I take steroids, my eye pressures go up, and it could cause really bad had ophthalmologic sequela. So I can't have steroids or anything for like anti-inflammatory because of my eye high pressure optic nerve cupping issue. But that's beside the point. So because I couldn't have anything for swelling, I got really, really swollen. So like I said, I was taking Benadryl, but I remember everything like almost got so distorted. And I, even as a surgeon myself, I needed reassurance from Dr. Rossi. And I'm like, Dr. Rossi, like, what if I mess up your work, or these stitches, what if they pull apart? He's like, this is bulletproof. I have anchoring stitches. He basically did surgical techniques within my lip lift surgery that protected my scar and the incision in such a way with his meticulous detail that like I said, the scar looks amazing. Again, I haven't had a laser, and this is despite me being really swollen and maybe not being the best patient afterwards because of my amount of swelling. But I think the surgical technique and having those deeper stitches anchoring that tissue down also made my scar look a lot better, and I feel like I've been very happy with the results. I'm ready to laser this, but honestly I don't even think I need to. And if I go like with my tongue, I can still kind of feel that there's stitches there, and even while he was doing the surgical procedure, the way anesthetic works, local anesthetic like lidocaine, the way that it works is first it knocks out the feeling of pain. Then, later on comes like pressure and mobility and all the other nerve innervation outcomes. So basically what I'm saying is I didn't have any pain, but I could feel what he was doing. And I remember being under, like on the little OR table, we were talking the whole time. He was playing my favorite music, and it was awesome. But I could feel him putting in those like deeper stitches, and I could feel him putting in these anchoring stitches and just all the meticulous work that he did. So I knew that it would be a really great result. And it was so funny because as a surgeon, from a surgeon's perspective, I'm like, oh, there he's putting in the Vicryl. Oh, there he's putting in like my, running subcuticular. Or, oh, he's putting in, it was really, really cute because I could feel what he was doing. And as a surgeon, as a patient, also, I could kind of feel exactly what he was doing. And I just know he did an amazing job. And again, it has a lot to do with the surgical technique. So find the right surgeon, do the right pre and post care, and don't worry if I'm scaring you or if I look weird, because each week I get better and better, and I'll do another maybe 6-month or 12-month follow-up lip lift surgery so that you can track my progress on my journey. Okay, one more thing I wanted to mention is just lip hydration after lip lift surgery. So when you invert your lips and you go from wet to dry, like the mucosal surface that's usually covered in saliva gets exposed to the atmosphere, so it kind of can get dry and chapped. So I use my MDR lip peptide mask. I also use Aquaphor sometimes. I just actually flew in, we just had my birthday trip. I was in Europe for the last 10 days. I flew in last night from Rome, Italy to LAX, landed at 10 p.m. last night and just worked a full day in clinic today. So, and I'm not even tired. I think it's just traveling without kids actually was relaxing, and I just was able to sleep on the plane. But my lips were really chapped, and to hydrate them, I use my MDR lip peptide mask and Aquaphor, but then I also stain it with, I use this lip stain. It's like this jelly from Milk Cosmetics. My 10-year-old daughter, who's obsessed with Sephora, actually introduced me to this, and it's in Splash. So I use a lip stain, then I just use my lip peptide mask or my MDR mask or Aquaphor, and then I also love this Buxom Dolly, because you guys always ask me what I use on my lips, but literally it's just usually some peptide lip mask and a lip stain, and that's how I get through clinic. And my lips are extra dry now because I just flew in last night. All right, love you guys. I hope you guys enjoy this content, and let me know what you want me to talk about next week. A lot of you guys are asking for endo lift, so I might do a video on that. Let me know if you want to hear more. Thank you so much for watching. Drop a comment in the comment section and share this video with someone who may find it useful. As always, I love you guys.